Question 1. Performance analysis shows that sonographers sometimes struggle to differentiate between common anatomical variants and early-stage pathology in the upper abdominal region. Which approach best ensures accurate diagnostic imaging in such scenarios? Option A. Rely on the sonographer's prior experience with similar-looking cases without re-verifying anatomical landmarks in the current examination. Option B. Immediately classify any structure that deviates from a typical textbook image as potentially pathological, prompting further investigation. Option C. Prioritize imaging of the most prominent organs and disregard minor variations in surrounding tissues, assuming they are within normal limits. Option D. Systematically evaluate all visualized anatomical structures, comparing findings against established sonographic criteria for normal anatomy and common variants, and document any deviations. Correct answer is D. Systematically evaluate all visualized anatomical structures, comparing findings against established sonographic criteria for normal anatomy and common variants, and document any deviations. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic medical sonography, where subtle variations in normal anatomy can be mistaken for pathology, or conversely, pathology can be overlooked if the sonographer's understanding of normal variations is insufficient. The professional challenge lies in accurately differentiating between expected anatomical structures and potential abnormalities, requiring a high degree of observational skill, knowledge of anatomical variations, and adherence to established imaging protocols. The pressure to provide a definitive diagnosis or rule out pathology necessitates a rigorous and systematic approach to image acquisition and interpretation. Correct approach analysis. The correct approach involves a systematic and comprehensive evaluation of the visualized anatomy, comparing findings against established sonographic criteria for normal structures and common anatomical variants. This aligns with the ethical and professional responsibility of a registered diagnostic medical sonographer, RDMS, to perform examinations with due diligence and accuracy, as mandated by the credentialing body's standards of practice and the principles of patient care. Adherence to established protocols ensures that all relevant anatomical regions are assessed, minimizing the risk of missed findings and contributing to accurate diagnostic reporting. This approach prioritizes patient safety and diagnostic integrity. Incorrect approach is analysis. One incorrect approach would be to focus solely on the most commonly visualized structures and disregard subtle variations or less prominent anatomical landmarks. This failure to conduct a thorough examination violates the principle of providing a complete and accurate diagnostic study, potentially leading to misdiagnosis or delayed diagnosis. Ethically, this represents a breach of professional duty to the patient. Another incorrect approach would be to prematurely label any deviation from a textbook example of normal anatomy as abnormal without further investigation or consideration of common variants. This can lead to unnecessary patient anxiety, further testing, and increased healthcare costs. It demonstrates a lack of nuanced understanding of anatomical variability, which is a core competency for an RDMS. This approach fails to uphold the standard of care expected of a credentialed professional. A third incorrect approach would be to rely on memory of previous examinations without systematically verifying the current findings against established anatomical knowledge. While experience is valuable, it should supplement, not replace, a methodical assessment of each patient's anatomy. This can lead to the perpetuation of errors or the overlooking of new findings. It represents a lapse in the rigorous application of diagnostic principles. Professional reasoning. Professionals should approach each examination with a mindset of thoroughness and critical evaluation. This involves 1. Actively recalling and applying knowledge of normal anatomy and its common variations. 2. Systematically scanning all relevant anatomical planes and structures according to established protocols. 3. Critically assessing each image for expected characteristics and identifying any deviations. 4. Consulting with peers or supervisors when encountering ambiguous findings. 5. Documenting all findings accurately and comprehensively. This systematic process ensures that diagnostic accuracy is maximized and patient care is optimized. Question 2. Compliance review shows a sonographer performing a renal ultrasound on a patient who is conscious and alert, but appears visibly uncomfortable with the degree of exposure required for optimal imaging of the kidneys. The sonographer has explained the need for the examination and the general area to be scanned. Which of the following actions best demonstrates adherence to professional and regulatory standards in this situation? Option A. The sonographer proceeds with the examination without further discussion, assuming the patient understands the necessity of the exposure for a complete scan. Option B. The sonographer stops the examination and informs the patient that if they are uncomfortable, the scan cannot be completed, potentially delaying diagnosis. Option C. The sonographer proceeds with the examination, ensuring all necessary views are obtained, while verbally reassuring the patient and adjusting draping as much as possible without compromising image quality. Option D. The sonographer immediately asks the patient to disrobe completely to ensure no obstructions to the ultrasound waves, regardless of the patient's visible discomfort. Correct answer is C. The sonographer proceeds with the examination, ensuring all necessary views are obtained, while verbally reassuring the patient and adjusting draping as much as possible without compromising image quality. Explanation. This scenario presents a professional challenge because it requires the sonographer to balance the immediate need for accurate diagnostic information with the patient's right to privacy and the ethical imperative to avoid unnecessary exposure. The sonographer must make a judgment call based on the clinical context and the patient's condition, adhering to established protocols and professional standards. The correct approach represents best professional practice because it prioritizes patient dignity and safety while still obtaining the necessary diagnostic images. By explaining the procedure and obtaining consent, the sonographer upholds the principles of informed consent and patient autonomy, which are fundamental ethical and regulatory requirements for healthcare professionals. This approach ensures that the patient understands what is happening and agrees to the examination, minimizing potential distress and promoting trust. An incorrect approach that proceeds without clear consent or explanation fails to respect patient autonomy and can lead to a breach of ethical standards and potentially regulatory violations related to patient rights. Another incorrect approach that unnecessarily exposes the patient beyond what is clinically required violates principles of patient dignity and privacy, which are protected by healthcare regulations. Proceeding with the examination without considering alternative positioning or draping that could maintain modesty while still achieving diagnostic quality is a failure to exercise professional judgment and adhere to best practices in patient care. Professionals should use a decision-making framework that begins with assessing the clinical necessity of the examination and the specific anatomical structures to be visualized. This should be followed by a clear and concise explanation of the procedure to the patient, including the rationale for any required positioning or exposure. Obtaining verbal or implied consent, depending on the situation and institutional policy, is crucial. The sonographer must then employ techniques that achieve the diagnostic goals while minimizing patient discomfort and maintaining modesty through appropriate draping and positioning. If the patient expresses discomfort or refuses a specific aspect of the examination, the sonographer should explore alternatives or consult with the referring physician. Question 3. Analysis of an ultrasound image reveals a cystic structure with a bright linear echo extending from its posterior margin. This artifact appears as increased echogenicity within the fluid and beyond the posterior wall of the cyst. Based on the fundamental principles of ultrasound physics, what is the most likely explanation for this observed phenomenon? Option A. Shadowing. Option B. Reverberation artifact. Option C. Beam width distortion. Option D. Posterior acoustic enhancement. The correct answer is D. Posterior acoustic enhancement. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic ultrasound, where the sonographer must interpret subtle visual cues to determine the underlying physical principles at play. The professional challenge lies in accurately identifying the cause of image artifact, which directly impacts the diagnostic quality and reliability of the ultrasound examination. Misinterpretation can lead to incorrect diagnoses, unnecessary further investigations, or missed pathology, all of which have significant clinical and ethical implications. Careful judgment is required to differentiate between various acoustic phenomena and their visual manifestations. Correct approach analysis. The correct approach involves recognizing that the observed artifact, characterized by a bright, linear echo originating from a fluid-filled structure and extending beyond its posterior border, is consistent with posterior acoustic enhancement. This phenomenon occurs when sound travels through a weakly attenuating medium, like a cyst, and emerges on the other side with increased intensity. This understanding aligns with the fundamental principles of ultrasound physics, specifically how sound wave propagation is affected by different tissue properties. Adhering to these principles ensures accurate image interpretation and upholds the professional standard of care expected of a registered diagnostic medical sonographer, as mandated by the credentialing body's guidelines, which emphasize a thorough understanding of ultrasound physics for accurate diagnostic imaging. Incorrect approach is analysis. One incorrect approach would be to attribute the artifact to reverberation. Reverberation artifacts are typically characterized by multiple, equally spaced, linear echoes that diminish in intensity and are seen behind strongly reflective interfaces. This is fundamentally different from the described artifact, and mistaking it would demonstrate a failure to apply basic ultrasound physics principles, potentially leading to misinterpretation of the underlying anatomy or pathology. This failure to correctly identify acoustic phenomena violates the professional responsibility to produce accurate diagnostic images. Another incorrect approach would be to assume the artifact is due to shadowing. Shadowing is the absence of echoes posterior to a strongly attenuating or strongly reflecting structure, such as bone or calcifications. The described artifact is a bright echo, not an absence of echoes, and its origin is a fluid-filled structure, not a highly attenuating one. Misidentifying this as shadowing indicates a lack of understanding of how different interfaces interact with ultrasound waves, a core competency for RDMS certification. A further incorrect approach would be to attribute the artifact to beam width distortion. Beam width distortion occurs when the ultrasound beam is wider than the structure being imaged, causing a solid-appearing structure to appear filled in. While this can affect image appearance, it does not manifest as a bright linear echo extending beyond a fluid-filled structure in the manner described. Failing to differentiate this from posterior acoustic enhancement shows a deficiency in understanding the spatial characteristics of the ultrasound beam and its interaction with various anatomical structures. This misapplication of physics principles compromises diagnostic accuracy. Professional reasoning. Professionals should approach such situations by systematically evaluating the visual characteristics of the artifact and relating them to known ultrasound physics principles. This involves considering the nature of the interface, e.g., fluid-filled, solid, calcified, the direction and appearance of the artifact, e.g., bright echoes, shadowing, reverberation, and the expected behavior of ultrasound waves interacting with these interfaces. When faced with an unfamiliar artifact, consulting established physics principles and imaging references is a crucial step. The decision-making process should prioritize diagnostic accuracy and patient safety, ensuring that all interpretations are grounded in sound scientific understanding and adhere to professional ethical standards. Question 4. System analysis indicates that during a routine abdominal ultrasound ordered to evaluate for cholelithiasis, a sonographer identifies a significant, unexpected lesion on the liver that is not related to the gallbladder. The sonographer has completed the examination of the gallbladder according to the physician's order. What is the most appropriate course of action for the sonographer in this situation? Option A. Attempt to further characterize the liver lesion by performing additional, non-protocolized ultrasound techniques and provide a preliminary interpretation to the patient. Option B. Document the liver lesion in the report but wait for the radiologist's review to mention it, as the ordering physician may not be the primary interpreter of liver findings. Option C. Ignore the liver lesion as it is outside the scope of the ordered examination and focus solely on the gallbladder findings. Option D. Document the liver lesion in the sonographic report with detailed measurements and descriptive characteristics, and immediately communicate this finding to the ordering physician. The correct answer is D. Document the liver lesion in the sonographic report with detailed measurements and descriptive characteristics, and immediately communicate this finding to the ordering physician. Explanation. The scenario presents a common challenge in diagnostic medical sonography: the potential for incidental findings that fall outside the primary scope of the examination, but are clinically significant. This requires the sonographer to exercise professional judgment, adhere to established protocols, and understand the scope of their practice within the regulatory framework of the Registered Diagnostic Medical Sonographer, RDMS, certification. The challenge lies in balancing the need for thoroughness and patient care with the specific requirements of the ordered examination and the limitations of their role. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established guidelines. By recognizing the incidental finding, documenting it appropriately, and communicating it to the supervising physician or ordering clinician, the sonographer fulfills their ethical and professional responsibility. This aligns with the RDMS certification's emphasis on competent and responsible practice, ensuring that significant findings are not overlooked and that appropriate follow-up can be initiated. This approach upholds the principle of do no harm by ensuring that potentially serious conditions are brought to the attention of the responsible medical professional. An incorrect approach that involves ignoring the finding fails to meet the standard of care and could have serious consequences for the patient. This constitutes a regulatory failure by not adhering to the implicit expectation of vigilance and reporting of significant findings, which is fundamental to diagnostic imaging. Another incorrect approach, such as attempting to diagnose or manage the incidental finding independently, exceeds the scope of practice for a diagnostic medical sonographer and represents a significant ethical and regulatory violation. Sonographers are trained to acquire and present diagnostic images, not to interpret them in a diagnostic capacity or provide medical advice. This overreach could lead to misdiagnosis or delayed appropriate medical intervention. Finally, an approach that involves documenting the finding but failing to communicate it to the supervising physician is also a critical failure. This breaches the chain of communication essential for patient care and can lead to the finding being missed by the treating physician, thus jeopardizing patient outcomes and violating professional communication standards. Professional decision-making in such situations requires a systematic approach. First, accurately acquire and document all relevant imaging data as per the ordered protocol. Second, critically evaluate the images for any deviations from normal anatomy or expected findings, even if they are not the primary focus of the examination. Third, consult established protocols and guidelines for incidental findings. Fourth, if a significant incidental finding is identified, document it clearly and comprehensively in the sonographic report. Fifth, communicate the finding promptly and effectively to the supervising physician or ordering clinician, providing all necessary imaging data. This ensures that the patient receives appropriate medical attention for all identified issues. Question 5. The monitoring system demonstrates a lesion located towards the patient's back and superior to the diaphragm. Which of the following descriptions most accurately and professionally conveys this anatomical relationship according to standard diagnostic medical sonography terminology? Option A, rearward and overhead from the diaphragm. Option B, towards the back and above the diaphragm. Option C, posterior and superior to the diaphragm. Option D, dorsal and cranial to the diaphragm. The correct answer is C, posterior and superior to the diaphragm. Explanation. The scenario presents a challenge in accurately communicating anatomical relationships during a diagnostic ultrasound examination. Precise directional terminology is crucial for clear and unambiguous reporting, ensuring that other healthcare professionals can interpret the findings correctly and make informed clinical decisions. Misinterpretation due to imprecise language can lead to diagnostic errors, delayed treatment, or inappropriate interventions. The correct approach involves utilizing standard anatomical directional terms that are universally understood within the medical community, as mandated by professional practice guidelines for diagnostic medical sonographers. These terms, such as anterior, posterior, superior, inferior, medial, lateral, proximal, and distal, provide a standardized framework for describing the location and orientation of anatomical structures and sonographic findings. Adherence to these established terms ensures consistency, accuracy, and clarity in medical documentation, which is a cornerstone of professional responsibility and patient safety. This aligns with the ethical obligation to provide competent and accurate diagnostic services. An incorrect approach that relies on subjective or colloquial descriptions fails to meet the professional standards of diagnostic reporting. For instance, using terms like towards the front or on the side is vague and open to interpretation, potentially leading to miscommunication. This lack of precision violates the principle of providing accurate and reliable diagnostic information. Furthermore, such imprecise language can be seen as a failure to adhere to the established professional practice guidelines that emphasize the use of standardized terminology, thereby compromising the integrity of the diagnostic process and potentially impacting patient care. Another incorrect approach might involve using terms that are specific to a particular patient's position rather than a fixed anatomical reference, which can also lead to confusion when reviewing images or reports at a later time or by a different clinician. This demonstrates a lack of understanding of the fundamental principles of anatomical description. The professional decision-making process in such situations requires a commitment to accuracy and clarity. Sonographers should consistently apply standardized anatomical directional terms in their reports. When in doubt about the precise term, they should consult anatomical references or experienced colleagues. The primary goal is to communicate findings in a manner that is objective, unambiguous, and readily understood by the entire healthcare team, thereby upholding the highest standards of patient care and professional conduct. Question 6. Research into the interpretation of sonographic images for a patient presenting with abdominal discomfort reveals a subtle hypoechoic area within the liver parenchyma. The sonographer has a general recollection of similar appearances in previous cases. What is the most appropriate course of action to ensure accurate and ethical diagnostic reporting according to RDMS standards? Option A. Focus solely on documenting the hypoechoic area without cross-referencing any external resources or considering the patient's clinical context, as the sonographer's visual assessment is paramount. Option B. Proceed with the examination, assuming the hypoechoic area is a normal anatomical variation, as it does not appear overtly concerning based on visual impression alone. Option C. Compare the observed hypoechoic area with established sonographic atlases and reference images for normal liver variants and known pathologies, while also considering the patient's clinical history and laboratory results. Option D. Immediately document the finding as a potential lesion and alert the referring physician, relying on the general memory of similar appearances from past examinations. The correct answer is C. Compare the observed hypoechoic area with established sonographic atlases and reference images for normal liver variants and known pathologies, while also considering the patient's clinical history and laboratory results. Explanation. This scenario presents a professional challenge because the sonographer must differentiate between subtle variations in normal anatomy and early signs of pathology, directly impacting patient diagnosis and subsequent treatment. The pressure to accurately interpret findings under time constraints, while adhering to established protocols and ethical standards, requires a high degree of skill and judgment. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by meticulously comparing observed findings against established normal sonographic parameters and documented patient history. This aligns with the core ethical principles of beneficence and non-maleficence, ensuring that the patient receives appropriate care based on reliable information. Furthermore, it adheres to the regulatory framework for Registered Diagnostic Medical Sonographers, RDMS, which mandates accurate reporting and adherence to established diagnostic criteria, as outlined by professional bodies and accrediting agencies governing sonographic practice in the United States. An incorrect approach that relies solely on visual memory without consulting established reference standards fails to meet the rigorous standards of diagnostic imaging. This can lead to misinterpretation of findings, potentially resulting in delayed diagnosis or unnecessary further investigations, which violates the principle of non-maleficence and could be considered a breach of professional duty under RDMS guidelines. Another incorrect approach that involves prematurely labeling a finding as abnormal without considering the full clinical context and patient history is equally problematic. This demonstrates a lack of critical thinking and can lead to patient anxiety and inappropriate medical interventions. The RDMS framework emphasizes a holistic approach to patient assessment, integrating imaging findings with clinical information. A third incorrect approach that involves deferring interpretation entirely to another healthcare professional without providing a comprehensive and objective sonographic report is a failure to fulfill the sonographer's primary responsibility. While collaboration is essential, the sonographer's role is to provide accurate and detailed sonographic data, enabling informed decision-making by the referring physician. This omission would contravene the expected scope of practice for an RDMS. The professional decision-making process for similar situations involves a systematic approach. First, Thoroughly review the patient's clinical history and the specific examination protocol. Second, systematically acquire high-quality sonographic images, ensuring all relevant anatomical structures are visualized. Third, critically evaluate each finding against established sonographic criteria for normal anatomy, considering patient demographics and physiological variations. Fourth, document all findings objectively and meticulously, noting any deviations from normal. Finally, communicate these findings clearly and concisely in the official report, allowing the referring physician to make an informed diagnosis. This process ensures adherence to regulatory requirements and ethical obligations, prioritizing patient well-being. Question 7. Strategic planning requires a sonographer to anticipate potential challenges in Doppler ultrasound examinations. If a physician requests a limited spectral Doppler assessment of a superficial vein, stating they only need to rule out significant stenosis, but the standard protocol for assessing venous insufficiency involves a comprehensive color Doppler, spectral Doppler, and pulsed wave Doppler evaluation of the entire affected segment and its tributaries. What is the most appropriate initial response for the sonographer? Option A. Immediately perform the limited spectral Doppler assessment as requested to comply with the physician's directive. Option B. Refuse to perform the examination, stating that the request is insufficient for a proper diagnostic study. Option C. Politely inquire about the specific clinical question and explain the standard protocol for assessing venous insufficiency, offering to perform the comprehensive study to ensure accurate diagnostic information. Option D. Perform the limited spectral Doppler assessment and document it as a complete venous insufficiency study. The correct answer is C. Politely inquire about the specific clinical question and explain the standard protocol for assessing venous insufficiency, offering to perform the comprehensive study to ensure accurate diagnostic information. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a direct conflict between a physician's request that may not align with established diagnostic protocols and the sonographer's responsibility to adhere to those protocols and patient safety. The sonographer must navigate the physician's authority while upholding their professional and ethical obligations, which are governed by the RDMS, American Registry for Diagnostic Medical Sonography, standards, and relevant U.S. healthcare regulations. The challenge lies in ensuring accurate and safe diagnostic imaging without compromising the integrity of the examination or potentially misinforming the physician. Correct approach analysis. The correct approach, which involves clarifying the physician's intent and explaining the standard protocol for assessing venous insufficiency, represents best professional practice. This aligns with RDM's ethical guidelines that emphasize the sonographer's role in performing examinations accurately and competently. It also implicitly adheres to U.S. healthcare regulations that mandate appropriate medical practice and documentation. By seeking clarification, the sonographer ensures they understand the clinical question and can perform the most appropriate examination. Explaining the standard protocol demonstrates professional knowledge and commitment to evidence-based practice. This approach prioritizes patient care and diagnostic accuracy, which are paramount in medical imaging. Incorrect approach is analysis. One incorrect approach would be to immediately perform the requested examination without clarification, even if it deviates from standard protocols. This fails to uphold the RDMS standard of competence and ethical practice, as it may lead to an incomplete or inaccurate study. It also risks violating implicit U.S. healthcare regulations regarding the appropriate standard of care. Another incorrect approach would be to refuse to perform the examination outright without attempting to understand the physician's request or explain the standard protocol. This could be seen as insubordination and a failure to collaborate effectively, which is a cornerstone of interdisciplinary healthcare teams in the U.S. While the sonographer has a duty to adhere to protocols, outright refusal without communication can hinder patient care and create professional friction. A third incorrect approach would be to perform the examination as requested and then document it as a standard venous insufficiency study without noting the deviation. This is ethically unsound and a direct violation of the RDMS principle of accurate reporting and documentation. It misrepresents the examination performed and could lead to diagnostic errors by the physician, potentially violating U.S. regulations concerning medical record integrity. Professional reasoning. Professionals should employ a decision-making process that prioritizes clear communication, adherence to established protocols, and patient safety. When faced with a request that seems to deviate from standard practice, the first step is to seek clarification from the requesting physician. This should be followed by a professional explanation of the standard protocol and its rationale. If the physician insists on a modified approach, the sonographer should document the request, the clarification provided, and the performed examination meticulously. If the requested modification poses a significant risk to patient safety or compromises the diagnostic integrity to an unacceptable degree, the sonographer should escalate the concern through appropriate channels within their institution, following established reporting procedures. This process ensures that patient care remains the primary focus while upholding professional standards and regulatory compliance. Question 8. The control framework reveals that during a routine fetal echocardiogram, a sonographer identifies a vessel coursing superiorly from the right atrium, parallel to the ascending aorta, and draining into the superior aspect of the right atrium. This vessel is not visualized connecting to the pulmonary artery. The sonographer must accurately assess this finding in the context of normal cardiac anatomy and its potential variations. Which of the following represents the most appropriate sonographic interpretation and subsequent action? Option A. Immediately report this as a critical cardiac anomaly requiring urgent surgical consultation due to its unusual course. Option B. Assume this is an artifact and disregard the finding to avoid unnecessary patient concern. Option C. Recognize this as a potential persistent left superior vena cava, PLSVC, and document its presence and drainage pattern, correlating with the absence of other cardiac anomalies. Option D. Conclude that the finding is a normal variant of the inferior vena cava and proceed with the rest of the examination without further documentation. The correct answer is C. Recognize this as a potential persistent left superior vena cava, PLSVC, and document its presence and drainage pattern, correlating with the absence of other cardiac anomalies. Explanation. The control framework reveals that a registered diagnostic medical sonographer, RDMS, must possess a comprehensive understanding of anatomical and physiological principles to accurately interpret ultrasound findings and ensure patient safety. This scenario presents a challenge because the sonographer is faced with an unexpected anatomical variation that deviates from typical presentation, requiring immediate application of advanced anatomical knowledge to differentiate between normal variation and pathology. Failure to do so could lead to misdiagnosis, inappropriate treatment, or unnecessary patient anxiety. The correct approach involves the sonographer leveraging their foundational knowledge of embryological development and anatomical variations to recognize the observed structure as a known, benign anatomical variant. This demonstrates best professional practice by prioritizing accurate diagnosis and patient well-being. Specifically, understanding the typical development of the fetal heart and its common variations, such as a persistent left superior vena cava, PLSVC, allows the sonographer to correctly identify the structure without alarming the patient or referring physician unnecessarily. This aligns with the RDMS credentialing body's emphasis on diagnostic accuracy and the ethical obligation to provide competent patient care, as outlined in professional practice guidelines that stress the importance of recognizing normal anatomical variations. An incorrect approach would be to immediately assume the finding is pathological and escalate without further investigation or consideration of normal variations. This could involve reporting the finding as a potential cardiac anomaly without sufficient differential diagnosis. Such an approach fails to meet the professional standard of care by potentially causing undue patient distress and burdening the referring physician with a false alarm. Ethically, it violates the principle of beneficence by not acting in the patient's best interest, as it could lead to unnecessary invasive procedures or anxiety. Regulatory failure lies in not adhering to the expected level of diagnostic competence and thoroughness required for RDMS certification, which implicitly includes the ability to distinguish normal from abnormal. Another incorrect approach would be to dismiss the finding entirely without proper documentation or consideration, perhaps due to unfamiliarity. This represents a failure in professional diligence and could lead to a misdiagnosis if the variation was, in fact, indicative of a more significant underlying issue or if it was misinterpreted as normal when it was not. This approach neglects the responsibility to thoroughly evaluate all sonographic findings and document them appropriately, which is a core requirement for maintaining professional standards and ensuring continuity of care. The professional decision-making process for similar situations should involve a systematic approach. First, assess the sonographic findings against established anatomical knowledge, including common variations. Second, if a finding is unusual, consider potential differential diagnoses, prioritizing benign variations before pathological conditions. Third, utilize advanced imaging techniques or consult with experienced colleagues or physicians if diagnostic certainty is not achieved. Finally, document all findings meticulously, including any considerations of anatomical variations, to ensure clear communication and appropriate patient management. Question 9. Which approach would be most appropriate for a registered diagnostic medical sonographer, RDMS, when imaging a superficial structure, such as a thyroid nodule, to achieve optimal diagnostic detail? Option A. Select a transducer with a higher frequency to achieve better resolution of superficial structures. Option B. Utilize a lower frequency transducer to ensure adequate penetration to visualize deeper tissues. Option C. Employ a medium frequency transducer to balance penetration and resolution for general imaging. Option D. Prioritize the transducer with the largest footprint for increased field of view. The correct answer is A. Select a transducer with a higher frequency to achieve better resolution of superficial structures. Explanation. This scenario presents a professional challenge because the sonographer must select the most appropriate transducer frequency for a specific diagnostic task, balancing image resolution with penetration depth. This requires a deep understanding of the inverse relationship between frequency and wavelength, and how these physical properties directly impact diagnostic image quality and the ability to visualize different anatomical structures. The challenge lies in applying this theoretical knowledge to a practical clinical situation, ensuring patient safety and diagnostic accuracy within the established regulatory framework for diagnostic medical sonography. The correct approach represents best professional practice because it prioritizes diagnostic efficacy and patient care by selecting a frequency that optimizes visualization of the target anatomy. This aligns with the core principles of diagnostic medical sonography, which are implicitly guided by the need for accurate and reliable diagnostic information. While specific regulations may not dictate exact frequency choices for every scenario, the overarching requirement for competent and ethical practice, as expected by bodies like the RDMS, American Registry for Diagnostic Medical Sonography, for RDMS certification, mandates the sonographer to make informed decisions that best serve the diagnostic purpose. This approach demonstrates a commitment to the highest standards of sonographic practice. An incorrect approach that prioritizes solely superficial imaging without considering the depth of the target anatomy would fail to meet diagnostic requirements. This could lead to incomplete or inaccurate diagnosis, which is a failure of professional duty, and could be considered a breach of the standard of care expected of a certified diagnostic medical sonographer. Ethically, it compromises patient well-being by not providing the necessary diagnostic information. Another incorrect approach, such as selecting a frequency solely based on convenience or habit without considering the specific clinical question, demonstrates a lack of critical thinking and adherence to best practices. This can lead to suboptimal image quality and potentially missed pathology, again failing to meet the professional and ethical obligations of the sonographer. A third incorrect approach, using a frequency that is too low for superficial structures, would result in poor resolution, rendering fine details undetectable and hindering accurate diagnosis. This directly contravenes the principle of obtaining the best possible diagnostic image. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical indication, the anatomical location and depth of the structure of interest, and the specific diagnostic questions to be answered. The sonographer must then recall and apply their knowledge of ultrasound physics, specifically the relationship between frequency, wavelength, penetration, and resolution. This knowledge should inform the selection of the transducer and its operating frequency. Finally, the sonographer should critically assess the acquired images to ensure they meet diagnostic standards and are appropriate for the clinical context, demonstrating a commitment to continuous quality improvement and patient-centered care. Question 10. The review process indicates a sonographer is tasked with evaluating the structural characteristics and spatial relationships of abdominal organs. The sonographer is considering which ultrasound imaging mode would be most effective for this specific diagnostic objective. Option A. Utilizing B mode to generate a two-dimensional cross-sectional image of the organs. Option B. Employing A mode to display echo amplitudes along a single scan line. Option C. Selecting M mode to visualize the motion of structures over time. Option D. Relying solely on Doppler to assess blood flow within the organs. The correct answer is A. Utilizing B mode to generate a two-dimensional cross-sectional image of the organs. Explanation. Scenario analysis. This scenario presents a professional challenge in accurately interpreting and documenting ultrasound findings, specifically differentiating between A mode, B mode, and M mode applications. The challenge lies in the sonographer's responsibility to select the most appropriate imaging mode for a given clinical question and to accurately describe the information obtained, ensuring it aligns with the diagnostic purpose. Misapplication or misinterpretation of these modes can lead to incomplete or inaccurate diagnostic information, potentially impacting patient care and requiring further investigation. Adherence to established protocols and understanding the fundamental principles of each mode are crucial for effective diagnostic ultrasound. Correct approach analysis. The correct approach involves recognizing that a mode provides a one-dimensional representation of tissue reflectivity along a single line. B mode offers a two-dimensional cross-sectional image, and M mode displays the motion of structures over time. Therefore, when assessing the structural characteristics and spatial relationships of tissues, B mode is the primary and most appropriate imaging modality. Its ability to create a comprehensive visual map of the anatomy is essential for diagnostic interpretation. This aligns with the fundamental principles of diagnostic medical sonography, as outlined by professional bodies and educational standards for RDMS certification, emphasizing the accurate application of imaging techniques to gather diagnostic data. Incorrect approaches analysis. Selecting A mode for assessing structural characteristics and spatial relationships is incorrect because A mode is limited to a single line of sight and does not provide the comprehensive anatomical visualization necessary for evaluating tissue structure and spatial arrangement. This failure to utilize the appropriate imaging modality for the clinical question represents a lapse in professional judgment and adherence to diagnostic standards. Choosing M mode for evaluating static structural characteristics and spatial relationships is also incorrect. M mode is specifically designed to visualize motion and temporal changes, such as cardiac valve movement or fetal heart activity. While it can provide information about the position of structures, its primary function is not the static assessment of tissue morphology or spatial relationships. Using M mode for this purpose would be a misapplication of the technology, leading to an incomplete diagnostic picture and potentially overlooking critical structural details. Professional reasoning. Professionals should approach diagnostic challenges by first understanding the specific clinical question being asked. This involves identifying what information is needed to answer that question. Next, they must recall and apply their knowledge of the different ultrasound imaging modes and their respective strengths and limitations. The decision-making process should then involve selecting the imaging mode that is best suited to acquire the necessary information efficiently and accurately. In this case, evaluating structural characteristics and spatial relationships inherently requires a two-dimensional representation of anatomy, making B mode the logical and diagnostically appropriate choice. This systematic approach ensures that the sonographer is utilizing their tools effectively and ethically to provide the best possible diagnostic information. Question 11. The analysis reveals that a sonographer is performing a transvaginal ultrasound for a patient experiencing pelvic pain. The patient expresses significant discomfort with a particular transducer angle that is typically used to visualize the posterior cul-de-sac. The sonographer needs to ensure a complete and diagnostically accurate examination while respecting the patient's physical limitations and emotional state. Which of the following actions best reflects appropriate professional conduct in this situation? Option A. Ask the patient to tolerate the discomfort, explaining that deviating from the standard protocol will render the images diagnostically insufficient and potentially lead to further medical investigation. Option B. Continue with the standard transducer angle, reassuring the patient that the discomfort is temporary and necessary for a complete diagnostic study. Option C. Gently attempt to reposition the transducer to an alternative angle that allows visualization of the posterior cul-de-sac without exacerbating the patient's discomfort, while continuing to communicate with the patient about their comfort level. Option D. Immediately cease the transvaginal portion of the examination and proceed only with the transabdominal scan, documenting the patient's reported discomfort as the reason for incomplete transvaginal imaging. The correct answer is C. Gently attempt to reposition the transducer to an alternative angle that allows visualization of the posterior cul-de-sac without exacerbating the patient's discomfort, while continuing to communicate with the patient about their comfort level. Explanation. The scenario presents a common challenge in diagnostic medical sonography, balancing the need for thorough diagnostic imaging with patient comfort and privacy, particularly when examining sensitive reproductive organs. Professional judgment is required to ensure the examination is both clinically adequate and ethically sound, adhering to established professional standards and patient rights. The correct approach represents best professional practice because it prioritizes patient dignity and informed consent while ensuring the diagnostic integrity of the examination. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as well as the regulatory expectation for sonographers to perform examinations competently and respectfully. Adherence to established protocols for reproductive system sonography, which include appropriate transducer manipulation and patient positioning, is crucial for obtaining diagnostic images without causing undue discomfort or compromising privacy. An incorrect approach that focuses solely on obtaining images without considering patient comfort or privacy would be a regulatory and ethical failure. This could violate patient rights to privacy and dignity, potentially leading to patient distress and a breach of professional conduct. Another incorrect approach that involves omitting essential views due to patient discomfort without attempting alternative methods or seeking further guidance would compromise the diagnostic quality of the examination, failing the sonographer's duty to provide a complete and accurate assessment. This could lead to misdiagnosis or delayed diagnosis, violating the principle of beneficence. Professionals should employ a decision-making framework that begins with a clear understanding of the examination protocol and the patient's specific needs and concerns. This involves open communication with the patient to explain the procedure, obtain consent, and address any anxieties. If a particular position or technique causes discomfort, the sonographer should explore alternative methods or transducer angles that can still yield diagnostic information, consulting with a supervising physician if necessary. The ultimate goal is to achieve a diagnostically sound examination while upholding the highest standards of patient care and ethical practice. Question 12. Operational review demonstrates that when imaging a structure with a known significant difference in acoustic impedance compared to surrounding tissues, the sonographer observes strong, bright echoes at the interface with reduced visualization of deeper structures. Which of the following approaches best addresses this imaging challenge to ensure diagnostic quality? Option A. Increasing the transducer frequency to improve resolution of the interface. Option B. Adjusting the overall gain to compensate for the reduced visualization of deeper structures. Option C. Recognizing the strong reflections are due to acoustic impedance mismatch and adjusting gain and potentially transducer frequency to optimize penetration and visualization. Option D. Ignoring the strong reflections and continuing with the examination as the interface is clearly visualized. The correct answer is B. Adjusting the overall gain to compensate for the reduced visualization of deeper structures. Explanation. Scenario analysis. This scenario presents a challenge in maintaining optimal image quality and diagnostic accuracy when encountering varying tissue interfaces. The sonographer must understand how acoustic impedance differences influence ultrasound wave behavior to interpret image artifacts and adjust parameters effectively. Failure to do so can lead to misdiagnosis or mispathology, impacting patient care. The professional challenge lies in applying theoretical knowledge of acoustic impedance to real-time imaging situations, ensuring patient safety and diagnostic efficacy within the established regulatory framework for diagnostic medical sonography. Correct approach analysis. The correct approach involves recognizing that significant differences in acoustic impedance between adjacent tissues cause strong reflections, which can attenuate the sound beam and reduce penetration. This understanding guides the sonographer to adjust gain settings and potentially use lower frequency transducers to improve visualization of deeper structures. This aligns with the RDMS, American Registry for Diagnostic Medical Sonography, standards which emphasize the sonographer's responsibility to optimize image quality for accurate diagnosis, adhering to principles of patient safety and professional competence. The RDMS Code of Ethics mandates that sonographers provide the highest quality diagnostic information and maintain their knowledge and skills. Incorrect approaches analysis. Ignoring the observed reflections and proceeding without adjustment fails to meet the diagnostic standard of care. This represents a failure to apply fundamental physics principles crucial for image formation, potentially leading to incomplete or inaccurate diagnostic information, which is a violation of professional responsibility and RDMS guidelines. Increasing the overall gain excessively, without considering the cause of the strong reflections, can amplify noise and obscure subtle details, compromising diagnostic accuracy. This demonstrates a lack of understanding of how gain interacts with signal strength and impedance mismatches, a failure in technical proficiency expected of an RDMS. Attempting to compensate solely by increasing the frequency of the transducer would exacerbate the problem of attenuation due to strong reflections, further degrading image quality, and demonstrates a misunderstanding of transducer physics and its relationship to acoustic impedance. Professional reasoning. Professionals should first identify the source of the strong reflections by considering the tissue interfaces involved. They should then apply their knowledge of acoustic impedance to predict the impact on image quality. Based on this analysis, they should systematically adjust imaging parameters, prioritizing those that directly address the observed phenomenon, e.g., gain, frequency selection, while considering the overall impact on penetration and resolution. This iterative process, guided by established physics principles and professional standards, ensures optimal diagnostic imaging. Question 13. Benchmark analysis indicates that sonographers are experiencing variability in image quality across different patient demographics and pathologies. When faced with a challenging imaging scenario requiring enhanced visualization of subtle structures, which approach to imaging system optimization best aligns with the RDMS regulatory framework and professional best practices for diagnostic efficacy and patient safety? Option A. Significantly increase overall gain and power output to the maximum allowable levels to ensure all structures are brightly visualized, regardless of potential artifacts or increased energy deposition. Option B. Prioritize scan speed by utilizing the highest possible frame rates and deepest penetration settings, even if it compromises spatial resolution and introduces motion artifacts. Option C. Rely exclusively on the system's pre-programmed default settings for all examinations, assuming they are universally adequate for all patient types and clinical indications. Option D. Systematically adjust fundamental imaging parameters such as gain, time gain compensation, TGC, depth, and focus to achieve optimal resolution and contrast for the specific anatomy and pathology, while monitoring energy output indicators. The correct answer is D. Systematically adjust fundamental imaging parameters such as gain, time gain compensation, TGC, depth, and focus to achieve optimal resolution and contrast for the specific anatomy and pathology, while monitoring energy output indicators. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic medical sonography, optimizing image acquisition parameters to balance diagnostic quality with patient safety and system efficiency. The professional challenge lies in understanding how different imaging system settings impact image fidelity, radiation dose, where applicable, though sonography is non-ionizing, energy deposition is a factor, and scan time, all while adhering to established protocols and the principle of ALARA, as low as reasonably achievable, for energy output. Careful judgment is required to select the most appropriate approach that maximizes diagnostic information without unnecessary exposure or prolonged scan times. Correct approach analysis. The correct approach involves a systematic evaluation of image acquisition parameters, prioritizing those that directly influence image resolution and contrast while minimizing unnecessary energy deposition. This aligns with the core principles of diagnostic imaging, which emphasize obtaining the highest quality image for accurate diagnosis. For sonography, this translates to optimizing gain, TGC, depth, focus, and frequency. The regulatory framework for RDMS, while not specifying exact parameter values, mandates adherence to best practices that ensure patient safety and diagnostic efficacy. By adjusting these parameters to achieve optimal visualization of anatomical structures and pathology, the sonographer is fulfilling their professional responsibility to provide high-quality diagnostic information. This approach is ethically sound as it prioritizes patient well-being by minimizing energy exposure while maximizing diagnostic yield, thereby avoiding unnecessary repeat scans. Incorrect approaches analysis. One incorrect approach is to solely rely on default or preset imaging system parameters without any adjustment. This fails to account for individual patient variations, anatomical differences, or specific imaging goals. It can lead to suboptimal image quality, potentially hindering accurate diagnosis and necessitating repeat scans, which is contrary to the ALARA principle. Ethically, this demonstrates a lack of diligence and professional responsibility. Another incorrect approach is to excessively increase gain or power output in an attempt to brighten the image or overcome poor technique. While this might make structures more visible, it can introduce excessive noise, artifacts, and potentially increase thermal index, TI, beyond acceptable limits, compromising diagnostic accuracy and patient safety. This violates the principle of using the lowest effective energy settings. A third incorrect approach is to prioritize speed of acquisition over image quality by using excessively high frame rates or large depths without proper focus. This can result in motion blur, poor spatial resolution, and missed pathology, directly impacting the diagnostic value of the examination and potentially leading to misdiagnosis. This is a failure to meet the professional standard of care. Professional reasoning. Professionals should approach imaging system optimization by first understanding the specific diagnostic question being asked and the relevant anatomy. They should then systematically adjust fundamental parameters like gain, TGC, depth, and focus to achieve optimal visualization of the target structures. This process should be guided by an understanding of how each parameter affects image characteristics, e.g., brightness, contrast, resolution, and energy deposition. The sonographer must continuously evaluate the image quality and make informed adjustments, always keeping the ALARA principle in mind. If initial adjustments do not yield satisfactory results, a re-evaluation of the chosen parameters and technique is necessary, rather than simply increasing power or speed. This iterative process of adjustment and evaluation, grounded in knowledge of physics and anatomy, is key to effective and safe sonographic imaging. Question 14. During the evaluation of a complex pelvic mass, which of the following approaches to 2D and 3D imaging techniques would best balance diagnostic yield with patient comfort and examination efficiency? Option A. Relying solely on standard 2D grayscale and color Doppler imaging, as 3D techniques are generally not necessary for characterizing pelvic masses. Option B. Prioritizing static 3D volume acquisition for comprehensive surface rendering of the mass and surrounding structures, followed by targeted 2D sweeps for detailed internal characteristics. Option C. Performing extensive 3D surface renderings of the entire pelvic region, regardless of the mass's specific location or suspected pathology, to ensure all potential abnormalities are visualized. Option D. Employing dynamic 3D volumetric imaging with multiplanar reconstruction capabilities to thoroughly assess the mass's spatial relationships, internal architecture, and vascularity, while minimizing prolonged static positioning for the patient. The correct answer is B. Prioritizing static 3D volume acquisitions for comprehensive surface rendering of the mass and surrounding structures, followed by targeted 2D sweeps for detailed internal characteristics. Explanation. Scenario analysis. This scenario presents a professional challenge because the sonographer must balance the need for comprehensive diagnostic imaging with the patient's comfort and the practical limitations of the examination. The choice of imaging technique directly impacts the quality and completeness of the diagnostic information obtained, as well as the patient's experience. Careful judgment is required to select the most appropriate method that yields diagnostic accuracy without causing undue discomfort or prolonging the examination unnecessarily. Correct approach analysis. The correct approach involves selecting the 3D imaging technique that best visualizes the specific anatomical structures of interest while minimizing patient discomfort and examination time. For example, if evaluating fetal anatomy, a static 3D acquisition might be preferred over a complex multiplanar reconstruction if the goal is a quick, clear surface rendering. If assessing a specific organ for subtle abnormalities, a more detailed volumetric acquisition with post-processing capabilities might be necessary. This approach aligns with the RDMS scope of practice, which emphasizes the acquisition of high-quality diagnostic images to aid in diagnosis. It also implicitly adheres to patient care standards, aiming for efficient and effective examinations. The RDMS certification implies a mastery of various imaging modalities and their appropriate application, ensuring that the chosen technique serves the diagnostic purpose optimally. Incorrect approach is analysis. One incorrect approach would be to exclusively rely on 2D imaging for all evaluations, even when 3D visualization offers superior anatomical context or the ability to detect subtle abnormalities not readily apparent in a single 2D plane. This failure stems from a lack of comprehensive understanding of advanced imaging techniques and their diagnostic utility, potentially leading to misdiagnoses or incomplete assessments, which violates the core principle of providing accurate diagnostic information. Another incorrect approach would be to perform complex, time-consuming 3D acquisitions without a clear diagnostic indication, solely for the sake of demonstrating advanced technique. This is inefficient, can cause patient discomfort, and deviates from the principle of performing medically necessary examinations. It also represents a misuse of resources and potentially exposes the patient to unnecessary scan time. A third incorrect approach would be to choose a 3D technique that is technically difficult to acquire or process in the specific clinical setting, leading to suboptimal image quality or an inability to obtain the desired diagnostic information. This demonstrates a lack of practical knowledge regarding the limitations of different 3D modalities and their application in real-world scenarios, compromising diagnostic accuracy. Professional reasoning. Professionals should approach this decision by first identifying the specific diagnostic question or anatomical region of interest. Then, they should consider the advantages and disadvantages of available 2D and 3D techniques in relation to that objective. Factors such as the required level of detail, the need for spatial relationships, patient factors, e.g., mobility, tolerance, and equipment capabilities should be weighed. The ultimate goal is to select the technique that provides the most diagnostically relevant information in the most efficient and patient-centered manner, adhering to established professional standards and guidelines for diagnostic medical sonography. Question 15. The assessment process reveals a patient presenting with acute onset of severe, colicky right upper quadrant pain radiating to the right shoulder, accompanied by nausea and vomiting. Based on the established indications for abdominal ultrasound within the U.S. regulatory framework for diagnostic medical sonography, which of the following is the most appropriate primary indication for performing this imaging study? Option A. Evaluation of suspected cholelithiasis or biliary colic. Option B. Routine follow-up of a previously diagnosed benign pancreatic cyst without change in size or symptoms. Option C. Screening for asymptomatic abdominal aortic aneurysm in a patient with no risk factors. Option D. Assessment of diffuse abdominal pain of unknown etiology without specific localizing signs. The correct answer is A. Evaluation of suspected cholelithiasis or biliary colic. Explanation. The assessment process reveals a patient presenting with a constellation of symptoms that could be indicative of various abdominal pathologies. The challenge lies in accurately identifying the most appropriate indications for abdominal ultrasound, based on established clinical guidelines and regulatory frameworks governing diagnostic medical sonography in the United States, as per the RDMS exam's jurisdiction. This requires a sonographer to not only possess technical proficiency, but also a thorough understanding of when and why a particular imaging modality is indicated, ensuring patient care aligns with best practices and regulatory compliance. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic accuracy by adhering to the established indications for abdominal ultrasound. This aligns with the principles of responsible medical imaging, as often outlined by professional organizations and implicitly supported by regulatory bodies overseeing healthcare quality. By selecting an indication that is well supported by clinical evidence and commonly accepted as a primary reason for abdominal ultrasound. The sonographer demonstrates adherence to the standard of care and avoids unnecessary or inappropriate imaging, which can lead to increased healthcare costs and potential patient anxiety or harm from incidental findings. An incorrect approach, such as ordering an ultrasound for a symptom that is not typically addressed by this modality or for which other diagnostic tools are more appropriate, represents a failure to adhere to established clinical protocols and potentially a violation of the principles of prudent medical practice. This could lead to misdiagnosis, delayed treatment, or unnecessary resource utilization. Another incorrect approach might involve performing an ultrasound without a clear clinical indication, which could be considered a breach of professional responsibility and potentially a violation of healthcare regulations concerning the appropriate use of diagnostic imaging services. This could also lead to the discovery of incidental findings that require further, potentially unnecessary, investigation. The professional decision-making process for similar situations should involve a systematic evaluation of the patient's presenting symptoms and medical history in conjunction with the established indications for abdominal ultrasound. This includes consulting relevant clinical guidelines and, when in doubt, seeking clarification from the referring physician. The sonographer must critically assess whether the proposed examination is the most appropriate and cost-effective diagnostic tool for the patient's specific clinical presentation, ensuring that the procedure is both medically necessary and ethically justified. Question 16. Operational review demonstrates that a critical ultrasound transducer, essential for a variety of diagnostic examinations, is exhibiting intermittent signal degradation, potentially affecting image quality and diagnostic accuracy. The sonographer has observed this anomaly during several recent patient scans. What is the most appropriate course of action for the registered diagnostic medical sonographer, RDMS, in this situation? Option A. Continue using the transducer for scheduled patient examinations, but make a mental note to inform the supervisor at the end of the day if the issue persists. Option B. Attempt to recalibrate the transducer using the machine's built-in diagnostic tools, hoping to resolve the signal degradation without involving other departments. Option C. Inform the patient about the potential equipment issue and ask if they are comfortable proceeding with the examination using the potentially compromised transducer. Option D. Immediately cease using the transducer and report the suspected malfunction to the supervisor and / or biomedical engineering department for assessment and repair. The correct answer is D. Immediately cease using the transducer and report the suspected malfunction to the supervisor and / or biomedical engineering department for assessment and repair. Explanation. This scenario presents a professional challenge due to the conflict between immediate patient care needs and the established protocols for equipment maintenance, which are critical for ensuring diagnostic accuracy and patient safety. Sonographer is faced with a situation where a potentially faulty piece of equipment could lead to misdiagnosis or delayed diagnosis if not addressed, yet deviating from established procedures carries its own risks. Careful judgment is required to balance these competing priorities. The correct approach represents best professional practice because it prioritizes patient safety and diagnostic integrity by adhering to established quality assurance protocol, reporting the suspected equipment malfunction immediately to the appropriate personnel, e.g., supervisor, biomedical engineering, ensures that the issue is formally documented and addressed by those responsible for equipment maintenance and repair. This aligns with the fundamental ethical obligation of the sonographer to provide competent care and to uphold the standards of the profession, which implicitly include ensuring the reliability of diagnostic tools. Regulatory frameworks for diagnostic medical sonography, such as those overseen by the American Registry for Diagnostic Medical Sonography (RDMS), which governs the RDMS credential, emphasize the importance of maintaining equipment in optimal working condition to prevent harm to patients and to ensure accurate diagnostic information. Failure to report such issues could be construed as a breach of professional responsibility and potentially violate guidelines related to quality control and patient safety. An incorrect approach that involves continuing to use the equipment without reporting the issue, despite a suspicion of malfunction, represents a significant regulatory and ethical failure. This directly compromises patient safety by risking inaccurate diagnostic findings, which could lead to inappropriate treatment or a lack of necessary intervention. It also undermines the quality assurance processes designed to prevent such occurrences. Furthermore, knowingly operating potentially faulty equipment could be seen as a violation of professional standards and could have legal ramifications. Another incorrect approach, such as attempting to fix the equipment without proper training or authorization, is also a failure. This bypasses established safety and maintenance protocols, potentially exacerbating the problem, causing further damage to the equipment, or even creating a safety hazard for the sonographer or others. It also disregards the expertise of trained biomedical personnel. The professional decision-making process for similar situations should involve a systematic evaluation of the situation. First, assess the immediate risk to the patient. If the suspected malfunction poses an imminent threat to patient safety or diagnostic accuracy, immediate action is warranted. Second, consult established protocols and guidelines for equipment malfunction reporting and troubleshooting. Third, communicate the concern clearly and promptly to the designated supervisor or department head, providing specific details about the observed issue. Fourth, follow the established procedures for equipment repair or replacement, which typically involve biomedical engineering or a designated maintenance team. This structured approach ensures that patient well-being remains paramount while upholding professional responsibilities and regulatory compliance. Question 17. Regulatory review indicates that registered diagnostic medical sonographers (RDMS) are expected to maintain high standards of patient care and diagnostic accuracy. During an abdominal ultrasound, a patient expresses significant discomfort due to the cold temperature of the ultrasound gel. The sonographer has access to a standard gel warmer that can bring the gel to a slightly elevated safe temperature. Which of the following actions best upholds the RDMS professional responsibilities in this situation? Option A. Proceed with the examination using the cold gel, informing the patient that discomfort is a normal part of the procedure. Option B. Gently warm the ultrasound gel to a comfortable, safe temperature before application, explaining the process to the patient. Option C. Immediately stop the examination and search for an alternative, non-standard method to warm the gel, even if it causes significant delay. Option D. Apply the cold gel and instruct the patient to tolerate the discomfort for the duration of the scan. The correct answer is B. Gently warm the ultrasound gel to a comfortable, safe temperature before application, explaining the process to the patient. Explanation. Scenario analysis. This scenario presents a professional challenge where a sonographer must balance patient comfort and the need for accurate diagnostic imaging. The patient's anxiety about the ultrasound gel's temperature, while understandable, could potentially lead to suboptimal image acquisition if not addressed appropriately. The sonographer's responsibility is to provide high-quality diagnostic services while maintaining patient well-being and adhering to professional standards. This requires careful judgment in managing patient expectations and the practicalities of the examination. Correct approach analysis. The correct approach involves acknowledging the patient's concern and offering a practical, non-disruptive solution that aligns with standard practice and patient care guidelines. Warming the gel slightly, within acceptable temperature ranges that do not pose a risk of thermal injury, is a common and effective method to enhance patient comfort without compromising the diagnostic integrity of the ultrasound. This approach demonstrates empathy, prioritizes patient comfort, and upholds the professional standard of care by ensuring the examination can proceed effectively. It aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Incorrect approaches analysis. One incorrect approach involves dismissing the patient's concern outright and proceeding with the examination without any attempt to address their discomfort. This fails to uphold the ethical principle of respect for persons and can lead to patient dissatisfaction, potential movement during the scan, affecting image quality, and a breakdown in the patient-sonographer relationship. It also neglects the practical consideration that a comfortable patient is more likely to remain still, facilitating better diagnostic imaging. Another incorrect approach might be to significantly delay the examination to find an alternative warming method that is not readily available or practical, thereby causing undue stress or inconvenience to the patient and potentially disrupting the clinic's schedule. While addressing patient comfort is important, the solution must be proportionate and efficient, adhering to established protocols for gel warming. A third incorrect approach could involve using a method to warm the gel that is unsafe or could compromise the gel's properties, such as using a microwave or excessively hot water. This would violate the principle of non-maleficence by potentially causing thermal injury to the patient or rendering the gel ineffective for diagnostic purposes. It also demonstrates a lack of adherence to manufacturer guidelines and professional best practices for ultrasound equipment and supplies. Professional reasoning. Professionals facing similar situations should first actively listen to and acknowledge the patient's concerns. They should then assess the feasibility and safety of potential solutions within their scope of practice and available resources. The decision-making process should prioritize patient comfort and safety while ensuring the diagnostic quality of the examination. Consulting with colleagues or supervisors for guidance on non-standard requests is also a valuable part of professional decision-making. The goal is to find a balance that respects the patient's needs without compromising the integrity of the medical procedure. Question 18. The performance metrics show a consistent increase in the turnaround time for abdominal ultrasound examinations, specifically those involving the digestive system. Which of the following strategies would be the most effective for optimizing the diagnostic process and improving patient care? Option A. Implementing a standardized protocol for all digestive system ultrasounds, including pre-scan checklists and post-scan review procedures, to ensure consistency and efficiency. Option B. Encouraging sonographers to reduce the time spent on each examination by focusing only on the most critical views. Option C. Delegating the initial interpretation of complex digestive system ultrasounds to less experienced sonographers to expedite reporting. Option D. Focusing solely on acquiring more advanced imaging equipment without addressing existing workflow inefficiencies. The correct answer is A. Implementing a standardized protocol for all digestive system ultrasounds, including pre-scan checklists and post-scan review procedures, to ensure consistency and efficiency. Explanation. The performance metrics show a consistent increase in the turnaround time for abdominal ultrasound examinations, specifically those involving the digestive system. This scenario is professionally challenging because it directly impacts patient care by potentially delaying diagnosis and treatment, and it raises concerns about resource allocation and departmental efficiency. A sonographer's role extends beyond image acquisition to ensuring timely and accurate diagnostic information is delivered. The correct approach involves a systematic review of the ultrasound workflow, from patient scheduling and preparation to image acquisition, post-processing, and report generation. This includes identifying bottlenecks, such as equipment downtime, inadequate staffing during peak hours, or inefficiencies in the electronic health record (EHR) system for documentation. By analyzing each step, the sonographer, in collaboration with the department manager, can implement targeted process improvements. This aligns with the ethical obligation to provide competent and efficient patient care, as well as the implicit responsibility to maintain professional standards and contribute to the effective functioning of the healthcare facility. Adherence to established protocols and guidelines for abdominal ultrasound, as outlined by professional bodies and regulatory agencies governing diagnostic medical sonography in the U.S., is paramount. An incorrect approach would be to solely focus on increasing scanning speed without considering image quality or diagnostic completeness. This could lead to suboptimal images, mispathology, and ultimately inaccurate diagnoses, violating the principle of do no harm and failing to meet the standards of care expected of a registered diagnostic medical sonographer. Another incorrect approach is to blame external factors without investigating internal processes. While external factors can contribute, a professional must first exhaust all internal avenues for improvement. Ignoring the performance metrics altogether or dismissing them as insignificant is a failure to uphold professional responsibility and a disregard for the potential negative impact on patient outcomes and healthcare system efficiency. Such inaction could be seen as a dereliction of duty, failing to proactively address issues that affect patient care and departmental operations. The professional decision-making process for similar situations should involve a data-driven approach. First, acknowledge and investigate the presented data, performance metrics. Second, engage in collaborative problem-solving with relevant stakeholders, e.g., department manager, other sonographers, IT support. Third, systematically analyze the workflow to pinpoint specific areas for improvement. Fourth, implement evidence-based solutions and monitor their effectiveness. Finally, maintain open communication regarding progress and challenges, ensuring that patient care remains the primary focus. Question 19. The efficiency study reveals that a sonographer consistently achieves diagnostic image quality within a shorter examination duration by utilizing higher acoustic output settings, leading to a slightly elevated thermal index, TI, and mechanical index, MI, that remain within the manufacturer's stated limits, but approach the upper end of commonly accepted diagnostic ranges. The sonographer believes this approach is justified by the efficiency gains. Option A. Consult with the equipment manufacturer to confirm that the higher acoustic output settings are safe for all patient types before continuing. Option B. Adjust acoustic output settings to maintain lower TI and MI values, even if it slightly increases examination time, to adhere to the ALARA principle and minimize potential bioeffects. Option C. Continue utilizing higher acoustic output settings as long as they are within the manufacturer's stated limits, prioritizing examination efficiency. Option D. Document the elevated TI and MI values and proceed with the examination, assuming no immediate harm will occur. Correct answer is B. Adjust acoustic output settings to maintain lower TI and MI values, even if it slightly increases examination time, to adhere to the ALARA principle and minimize potential bioeffects. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the sonographer to balance the diagnostic imperative with the ethical and regulatory obligation to minimize patient harm from ultrasound bioeffects. The sonographer must interpret study findings in the context of established safety guidelines and patient-specific factors, rather than solely focusing on image acquisition efficiency. The challenge lies in discerning when observed effects might exceed acceptable thresholds and require intervention, even if it impacts the speed of the examination. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient safety as mandated by regulatory frameworks governing diagnostic medical sonography. Specifically, the American Institute of Ultrasound in Medicine (AM), bioeffects intensity levels, and the Food and Drug Administration (FDA) guidelines on ultrasound equipment output limits are paramount. These regulations and guidelines emphasize the ALARA, as low as reasonably achievable principle for acoustic output. A sonographer demonstrating this best practice would recognize that exceeding established thermal or mechanical indices, even if leading to a technically efficient study in terms of time, could pose a risk of unintended biological effects. Therefore, adjusting parameters to stay within safe limits, even if it slightly increases examination time, aligns with the ethical duty of non-maleficence and regulatory compliance. Incorrect approach is analysis. One incorrect approach involves disregarding the observed bioeffects because the study was completed within the expected time frame. This fails to adhere to the ALARA principle and the AM/FDA guidelines, which do not permit efficiency to supersede safety. The regulatory failure is in neglecting the responsibility to monitor and control acoustic output, potentially exposing the patient to unnecessary thermal or mechanical stress. Ethically, this constitutes a breach of non-maleficence. Another incorrect approach is to assume that any observed bioeffect is acceptable as long as no immediate adverse reaction is reported by the patient. This is a critical misinterpretation of bioeffects. Regulatory guidelines are based on scientific understanding of potential cumulative or subtle effects, not just immediate patient complaints. The failure here is a lack of understanding of the scientific basis for bioeffects and a disregard for established safety thresholds, leading to potential long-term or subclinical harm. This is a regulatory and ethical failure to uphold the standard of care. A third incorrect approach is to attribute any observed bioeffects solely to patient physiology without considering the ultrasound equipment's acoustic output settings. While patient factors can influence susceptibility, the sonographer's primary responsibility is to manage the output. The regulatory failure is in abdicating responsibility for controlling the energy delivered to the patient. Ethically, this demonstrates a lack of diligence in applying established safety protocols. Professional reasoning. Professionals should approach such situations by first understanding the established bioeffects principles and the relevant regulatory limits, AM, FDA. They should then critically assess the observed bioeffects in the context of these limits and the specific patient's clinical situation. Decision-making should involve a systematic evaluation of acoustic output parameters, e.g., thermal index, mechanical index, and their potential impact. If observed effects approach or exceed safe thresholds, the professional decision is to adjust parameters to reduce output, even if it means a slightly longer examination time, thereby adhering to the ALARA principle and best practices in patient care. This involves a proactive approach to risk management rather than a reactive one based on immediate patient feedback or study completion time. Question 20. Implementation of standardized anatomical terminology in sonographic reports is crucial for clear communication. If a referring physician dictates findings using a term like belly button area to describe the umbilical region, what is the most appropriate approach for the registered diagnostic medical sonographer to document this finding in their official report? Option A. Document the finding using the precise anatomical term umbilicus and note the referring physician's descriptive term in the clinical history section if relevant. Option B. Document the finding using a more general descriptive term like abdominal midline structure to avoid potential misinterpretation of specialized terms. Option C. Document the finding using the referring physician's descriptive term belly button area to maintain consistency with their dictation. Option D. Document the finding using the term navel, as it is a commonly understood synonym for the umbilical region. The correct answer is A. Document the finding using the precise anatomical term umbilicus and note the referring physician's descriptive term in the clinical history section if relevant. Explanation. The scenario presents a common challenge in diagnostic medical sonography: the potential for miscommunication due to variations in anatomical terminology, particularly when interacting with referring physicians or other healthcare professionals who may use less precise or outdated terms. This can lead to diagnostic errors, delayed treatment, and patient safety concerns. The challenge lies in ensuring that the sonographer's documented findings are universally understood and accurately reflect the anatomical structures visualized, adhering to established professional standards. The correct approach represents best professional practice because it prioritizes the use of standardized, universally accepted anatomical terminology as defined by authoritative bodies relevant to the RDMS certification. This ensures clarity, accuracy, and consistency in medical reporting, which is a fundamental ethical and regulatory requirement for diagnostic imaging professionals. Adherence to these standards minimizes ambiguity and facilitates effective communication among the healthcare team, ultimately benefiting patient care. The RDMS certification itself implies a commitment to upholding these professional standards. An incorrect approach that relies on colloquial or non-standard terminology fails to meet the professional and regulatory expectations for accurate medical reporting. This can lead to misinterpretation of findings, potentially resulting in incorrect diagnoses or treatment plans. Such a failure constitutes a breach of professional responsibility and can have serious ethical and legal ramifications, as it compromises the integrity of the diagnostic process. Another incorrect approach that uses overly simplistic or descriptive terms without precise anatomical identification also falls short. While intended to be clear, it lacks the specificity required for accurate medical documentation and can obscure critical diagnostic information. This undermines the diagnostic value of the sonographic examination and deviates from the expected standard of care. A further incorrect approach that incorporates terminology from a different medical specialty without proper context or justification introduces confusion and potential for error. Medical terminology is precise, and its misuse can lead to significant misunderstandings among healthcare providers. The professional decision-making process in such situations should involve a commitment to continuous learning and adherence to established anatomical nomenclature. When encountering unfamiliar or potentially ambiguous terminology, the sonographer should consult authoritative anatomical atlases, glossaries, or seek clarification from the referring physician, always prioritizing the use of precise and standardized terms in their reports. This ensures that the diagnostic information conveyed is accurate, unambiguous, and professionally sound, aligning with the ethical obligations and regulatory requirements of a registered diagnostic medical sonographer.